would like to call to order our May 4th, 2015 Board of Commissioners work session. Welcome, everyone. It says on here, courtesy reminder to silence mobile devices. I think that's more for me than anybody else. But please silence your cell phone. And we will start off our meeting with an introduction by County Manager Downs.
Who am I introducing?
You are introducing.
Yeah, Lisa, here, come on up. This is Lisa Hammond. Lisa is our new safety and risk manager. Lisa has taken Tony Harris's place, and she's already hit the ground running along with Andy and making sure that our policies are up to date and ready to go for the new fiscal year. Lisa spent 8 years with she started the program for the town of Mooresville, and then she took a short stint down to Clemson University, and then she decided to come back to North Carolina, and we're glad she did. So we wanted to make sure you see her face and get to meet her, and I talked loud enough. So, if you have any questions, Lisa, you want to say anything, you can go.
Pleasure to be here, and I look forward to working with everyone.
Okay. Thank you.
Great.
Thank you.
Welcome. We're glad to have you on board.
Thank you.
Okay. Next up is approval of the work session agenda, and I would entertain a motion at this time.
Mr. Chairman, I'll make a motion that we approve the agenda with the changes.
Thank you. Do I hear a second?
Second.
Okay, any discussion? All in favor, please say aye. All opposed, no. The motion passes. Discussion items. First up, 3.1, regarding the driveway for the senior center, and I think Jonathan's going to tell us about that.
So this item was tabled to this meeting based on a zoning hearing that was supposed to take place with the City of Concord last week, or the week before last, and the petition was withdrawn. It looks like they will refile it with a new site plan. So at this point, we're just recommending that you place on your agenda, since it had been tabled to your May meeting, place it on your agenda and table it indefinitely, and we will bring it back to you once that zoning action has been heard by the city, if there is any reason to bring it back to you.
Great, thank you. And I think that was our discussion at that time, was we wanted to see what direction the city was going before we took a position, so.
Do you need a motion to table this again?
It'll just
yes.
go on your, I think it'll be on your consent, it's set up, it'll be on the consent agenda, just as the action is to table it.
So continue to table it until we bring it off the table. Okay, next up, a report from Cabarrus Farm and Food Council, and I think Kelly Sifford's going to talk with us about that.
Good afternoon. I'm just going to introduce Aaron and let him take it away. This is Aaron Newton. Trish could not be with us today, and I thought Aaron was going to be here, but maybe she's got caught up. So you all know Aaron Newton, and he'll be talking to you about what the Cabarrus Farm and Food Council has been doing.
And Trish sends her apologies. She had a last-minute change in schedule. I told her I would step in. The Cabarrus Farm and Food Council was created by a resolution of the Board of Commissioners in 2010 to identify and strengthen the connections between food, health, natural resource protection, economic development, and the agricultural community. And they were charged with performing research, educating the community, developing strategies, and making policy recommendations that would encourage the development of a robust, sustainable local food economy and a healthier population. All goals, I think, still exist today, 5 years later. The Cabarrus Farm and Food Council has met continuously for 5 years, including over the last 8 months, and you were provided with a list of their accomplishments dating back to their inception in 2010. Their current work includes a long-term hunger relief advisory committee that's been meeting for about 2 years, the purpose of which is to work with existing hunger relief agencies and organizations to identify the needs and the resources within our community to strengthen those efforts. Also, a school gardens committee that's committed to establishing growing spaces on our school campuses here in Cabarrus County so children can learn more about where food comes from and how to eat well. And also, most recently, a Food Hub Exploratory Committee, and this is aimed at organizing the efforts to create a local food distribution center capable of aggregating, packing, and distributing local food to meet the needs of local farmers and the institutions that would love to purchase their foods from our local farmers. So their work continues today, and as a member of the council and taking Trish's place, I'm here to give you an annual update per the resolution that created the council, but also to look maybe for a little clarification about the relationship between the council and county government. The council was officially defunded last year, and not here to ask for any money. There's nothing attached to this agenda item that looks for any funding, but just really more to clarify the relationship between the council, which was created as an advisory committee to this board, and to let you all know a little bit more about the work of the council and the fact that it has continued for the last 8 months. Can I answer any questions you all might have?
Thank you. Thank you, Aaron. Questions, commissioners?
I don't really have a question, but I do have a comment. I don't know, those of you that attended the ribbon cutting for the Rotary Square on Saturday, I purchased some of the organic vegetables from a couple of the farmers and cooked them the same day, and they were really good. And I talked to some of the farmers from the Elmer C. Lomax Incubator Farm, and you know, it was good, and the food obviously was very good too. So it's doing a good job, Aaron. Thank you.
Well, thank you. I'm glad you brought up Rotary Square, Commissioner Shute. The lion's share of the work to get that project up and running was taken on by Concord Rotary Club, Brian King, and the members of that club. The partnership between Rotary, Piedmont Farmers Market as an organization, Cabarrus County, City of Concord, WASAC, Water and Sewer Authority of Cabarrus County, and the Concord Downtown Development Corporation. A lot of players involved. Part of the way that those relationships formed was through the council's work. So the council creates this space in our community where partnerships can be created, where people can come together to talk about what's necessary to build a robust food economy here in our community. And long before Brian ever presented that idea formally to the city or to the county, he came to a council meeting and was able to flesh that idea out and share it with those of us who are on the council. So that's a great example of a project not created by the council. I don't want to take credit for that at all. But the space the council created was help in bringing the partners together that then went on to create the project itself.
I have a question.
Yes, ma'am.
You mentioned selling the produce and the so forth to restaurants and things like that. Is there a formal way, or how does that come together?
One of the difficulties we see is that small farmers by themselves may not grow enough of what is needed to meet a restaurant's need or to meet an institution's need, like for instance, the hospital. So if local growers could work together and have a place where they could go and drop off food that could be packaged and aggregated to then meet the larger needs of institutions, or could be funneled and redistributed to restaurants, take some of the work off that farmer who really wants to be back at the farm doing the work of growing the food, then that would be a real benefit to the farmer. So this particular committee is exploring what that idea would look like, who the partners for that project would be within our community, how they could come together, what the needs would be, what the resources we may have in our community that could help meet some of those needs, so that farmers could easily sell through a center like that to the restaurants.
So that's an ongoing thing that
Just started.
Okay. Look forward to hearing more about that.
Right.
I will give a disclaimer because my daughter is a member of this particular council. She had to be interviewed to make sure that her thoughts, I guess, say you do that with any of your members. They come in for an interview first, or kind of meet and everybody and learn of what the vision is, and make sure that kind of syncs with them and becoming members. They're all volunteers that spend a fair amount of time. Depending on who they are, they spend more than, depending on which of those areas they're in, they may spend more time than others. I think that there should be a relationship between the Board of Commissioners and the council. I think it was a good relationship to begin with. That's how it was started. your budget for this particular council was extremely small. Can you tell me what it was?
It was never in excess of $6,500 per fiscal year, but, and again, we're not here to ask for any money, but yes. it
Well,
was.
I mean, I knew it wasn't much. I mean, but it did help with some of the planning that you were doing. So I think it's important for us, if we are truly concerned about the rural parts of our county and we're truly concerned about farms and local food, that we do have a connection. I was going to use the word sanctioned. I'm not really certain that's the right term, but I think there should be a connection, and I would not be opposed for in our next fiscal year to have again, it was already very small, but to have a presentation from them to go to staff of some needs that they might truly have. And I think you've probably had time to figure out with no money what you really do have a need for. I mean, I don't think there's a need to buy a bunch of T-shirts to hand out for free, but I think that, you may have something with different meetings and things that would be good if you had a small amount of money to help you cover some of your basic expenses like that. So, but I think they've done a great job, and it's brought a lot of awareness, and I think the people that are on that council have greatly benefited from being on the council, and I think that the county will continue to benefit by having their insight and their forward thinking on these issues. So,
Yeah.
and I appreciate what you've done.
Aaron, the Food Policy Council and the farm, have they joined? Are they still two separate entities that meet together and share members, or have they joined efforts?
They have not joined efforts. The council's work is, logistically speaking and formally speaking, separate.
Okay,
from
that's
the
what I
Lomax
wanted to make
Incubator
sure.
Farm.
Yeah, okay. I just wanted to reinforce that while it was, the farm was not funded, this board did provide $25,000 for the calendar year through December of this year. So there was funds there. I just wanted to make sure the two together, so they are two separate entities. So exactly what you're saying, we could look to do that, so.
And I don't have to wait. Okay. The other thing I was going to ask, since you're here, it's tangent from this, but you having the farm, Lomax Farm has a big event coming up soon.
We do.
Do you want to give a plug for that event?
Absolutely, sure.
I've already asked Commissioner Morris to pay for for me to be able to attend. I haven't gotten a positive response from him on that yet, but you're welcome to make that pitch to him that he could pay that
Still under
$1,000, so I'm still trying. Okay, I just want to make sure it's still under consideration.
It's coming up. We do. We have a fundraising event, a dinner on May 15th. Again, a lot of partnerships within the community coming together. The event will be hosted at Ritchie Hill at the new event space on South Union Street. Scott Avett was the driving force behind this dinner, and Scott will be joining us for the evening, as well as his band, another member of the Avett brothers, Joe Kwan. Joe is friends with Vivian Howard of A Chef's Life with the show on PBS, and Ms. Howard has graciously agreed to come and be our chef for the evening for the event. She will also be in town to shoot some film at Lomax Farm, as well as at the event itself, with the goal that it becomes an episode of A Chef's Life in the future. So that event is happening on May 15th. Tickets are available at the Carolina Farm Stewardship Association's website. I'd love to have any of you join
So
us.
how much is Commissioner Poole's ticket going to cost me?
$1,000.
$1,000. Like I said, under consideration. Any other questions for Aaron? I would first of all thank you for so clearly explaining all the pieces that were involved in the Rotary Square project, and I think I certainly agree with you. The Concord Rotary Club. And Brian King and his leadership deserve a tremendous amount of credit for that. Thank you for what your group did to bring together all those different parties to collaborate, which is what really makes it a very valuable experience, I think, and ongoing for everyone. And it was great to be there and see the kids enjoying the fountain and the produce, and Commissioner Shue doing his shopping, and, you know, I hung around for a while thinking he would invite me over to eat some of that stuff, but he didn't. But, you know, my question to you would be, you know, you asked for some clarification as to the relationship between the board and the council. Do you have thoughts or suggestions, or is that something that the board would like to bring back to us as to how they think that relationship should look and how we can be beneficial to what they're trying to do?
The council, I would say, feels that a relationship with the Board of Commissioners would be one to maintain. They see a benefit as well to their work. But what I would suggest is that maybe leaders within the council meet with staff and hash out some recommendations that maybe that they could present to you about, you know, sort of more formally how the council would be be associated with you all, what resources might be reasonable to request. So that's the way I think we should go. That way we have sort of a broad consensus on that basis on behalf of the council, but also we have some input on staff about what they think is reasonable to suggest.
Sounds like a good approach to me. Any other questions for Aaron? Thank you very much for being with us today.
You're welcome. Thank you.
Okay, next up we have an update on the potential impacts of the Senate's proposed county sales tax redistribution bill, and Susan Farrington's going to talk with us about that.
Yeah, with all the stuff that's flying around right now and all the different interpretations and everything that we're trying to get, it's tough for us to understand the impacts of what these proposed bills are. So that's why we asked Ms. Farrington to come in and tell us what all this means and what are the true impacts to Cabarrus County, because some of the numbers that are going around are not totally accurate. So this will help us and you understand the difference between the two proposed bills and what those impacts are on Cabarrus County, so that if they start progressing through the process, which direction should we go in our advocacy efforts locally as well as the association. So.
Okay. I want to apologize in advance. I have a squeaky voice getting over a cold, but anyway. This afternoon, I wanted to give you a quick overview of the local option sales tax as it's right now and the two bills that are out there. The first one, the Senate Bill 369, is called the Sales Tax Fairness Act, and the Senate Bill 608 is a simple and fair formula for sales tax distribution. Currently, there's 38 states that now have some form of local option sales tax. The sales tax, you know, through the years have become the second largest revenue producer for the county, right behind the property taxes. And right now, the North Carolina has authority to adopt multiple multiple different sales tax. We currently have Article 39, which is 1 cent, Article 40, which is a ½ cent, Article 42 is another ½ cent, and then not all counties, but some of them do, have Article 46. Article 46, we do not share with municipalities. We get to keep that one for ourselves, and that was specifically voted on and approved a couple years ago for school infrastructure and for debt service. So right now, when you see the 7% sales tax when you go to purchase something, 2.25 of that is local, and then 4.75 is state. And right now for 15, our estimated sales tax is coming in a little over budget. In fact, we think there's probably going to be about $3 million over budget for 15. For 16, we've estimated like a 3% increase. So if everything stays the same, 3% increase for next year. However, when we get our sales tax, just to get you a little bit updated, the sales tax comes into the county. Of course, all the sales tax is collected by the retailers, is submitted to the state, and it comes back to the county and the municipalities. Of that portion, Cabarrus County gets about 67%. So if you're looking at that 2% sales tax that is shared, we get 67% of that. And then the cities get the rest of it. However, when we get our 67%, since we're on the ad valorem method, we share that with our fire districts. So another 2.3% goes to the fire districts. We distribute that monthly.
May I ask
Yes.
a question? Everything you just said this last minute is not on our sheet, right?
Your sheet just has points for some charts and things.
Okay, because it's really hard to follow
Oh, I'm sorry.
everything that you're saying. Okay.
I can get you copies of my notes if you'd like. Okay, I can do that. The spreadsheet you have some charts and maybe some things, some takeaways. The things I've just, so far, I've told you some history on the sales tax. Going back to this, just to give you an idea, sales tax is about 17% of our budget, and our property tax is about 60% of our revenues. There's an increased importance recently about the ability for revenue capacity between all the different counties, and that's what brought some attention to these bills. Just to give you an idea, there's a concern related that they reference what's called tax leakage, and that's where you have people who are going to different counties. They might live in one county and go to another one and make their purchases. If you go to a different county to make your purchases, then that sales tax gets to stays in the county where you make your purchase. So Cabarrus County is benefiting because we have Concord Mill. So we have all the people coming into Cabarrus County, so that's a good thing. But we also have people we know, they live in Harrisburg and other places, they're going to Charlotte to making their purchases. So some of that leaks over to Mecklenburg County. So it's, give and take. But there is some concern for different counties who do not have the retail base that we do, that are losing out. And so some of the, hold on for a second.
Susan, let me ask you a question of clarification before we go much further, so I'll know where I'm at. You said that of the 2.25%, 2.25% that the county gets, of the 7%, we have to distribute all but 67%. Is that right?
That's right. 67% comes to Cabarrus County.
To the county.
And then the cities get a piece of that pie also.
The other municipalities get the
Yes.
33% difference?
Yes.
Okay.
And then of our 67, about 2.3, we distribute with our fire districts.
Okay.
But the state actually sends the money directly to the cities, whereas the county receives the piece for the county and the fire districts. So we cut checks or EFTs once a month to distribute to the fire districts. And they count on that money. We give them estimates, and we told them, just like we're doing, we have 3% increase for next year. We told them, expect about 3% increase for your revenues for next year. Back to the tax, what we call tax leakage. A lot of times, it sounds good that we're getting all this extra sales tax from people coming into our county purchasing things, but it also puts a strain on our services too, as far as police and sheriff deputy services. Cities have to provide infrastructure. Concord Mills, when it came, they had to build things around it too. So it's a burden too. So in our defense, I guess, we would like to see the sales tax stay the same because we're providing those services. We have to pay for those services annually. It's an operating cost, and infrastructure is capital outlay. So that's one of the things that we like to point out. Okay, it's important to notice that in one of the articles I read, it says the importation of sales tax dollars allows urban jurisdictions, which is where we're considered, to capture revenue from non-residents that would otherwise benefits from those public goods and services who don't pay for them. So that's why we like sales tax so good. People can share in the burden of what our expenses. And like I said, on the other hand, we do have people going to Mecklenburg County, so it goes both ways. Okay, so that's a little background behind our sales tax. The two bills that are now in the limelight. On March 23rd, Senator Harry Brown from Onslow County introduced Senate Bill 369, the Sales Tax Fairness Act. And the bill has currently been referred to the Committee on Finance. So that's where it's sitting. Okay, this act would fundamentally restructure the county levy sales tax system by converting the first 2-cent levies authorized, which is our Article 39, 40, and 42, into a state sales tax. And then it would be distributed to the counties based on ad valorem, on population, not ad valorem. While this bill's language clearly states that the funds will be local revenues and not a state expenditure, the state levied allocations would still flow through the state's budget each year. So they say it's a local revenue for us, but it's still going to go through their appropriation process. So just to point that out, that it would go through their expenditures. If all sales tax were distributed on a per capita basis, this would result in the areas of higher sales tax bases subsidizing the rest of the state. It would also remove the local part of the tax by essentially making, like I said, a state sales tax. It said the result would indeed be a more even distribution of local sales tax across the state, but there could be consequences as well, like I mentioned earlier about the roads and public safety. And also, there would be no longer be an incentive to increase our sales tax base. What would be our purpose of doing that? And the article pointed that out to us. Then, the reallocation would be phased in over several years, and this part is on your spreadsheet here. The changes are not immediate. It's over a 3-year time period. So the first thing that would happen would be January of 2016. Article 40 and 42 would go away as far as we don't know it now and can become a state sales tax, and so then be distributed back. So that's halfway through our FY17 year. And then the next thing that would go away would be January 17, and then half of our Article 39, which is a penny, would go to the state sales tax and be distributed back on a per capita basis. And then the final piece in January of 2018 would be the final part of the 2 cents would go to a state sales tax. So at that point, the state sales tax would be 6.75. That quarter-cent sales tax I told you about earlier, 46, will remain ours because it was passed for schools, and it is per cap. It is ad valorem based. I have a chart there that compares us to some counties around us just to see what the reductions or increases, just for information. I thought it was interesting to look at. I've got Cabarrus as decreasing 16.8, and this is as of we're going to gradually go into it. This is by FY19. We're going to be down 16.8% from what we would normally have collected through those years. Catawba, I've got Mecklenburg being down 33.4%. Rowan tends to gain, so it depends on where you are in the state. This impact, just to give you some dollars, would be $6.1 million. That represents 3.2 cents on our tax rate, because right now a penny on the tax rate is 1.9 million. So that's 3.2 cents on our tax rate to compensate for that. And based on this method, there would no longer be an incentive to increase the size of the county sales tax base, which I mentioned earlier. Any questions on the first tax bill?
One thing to note on that too, as Susan said, this requires you to change from the ad valorem collection process to the per capita. So not only are we losing, the fire departments are losing as well, because it no longer requires the county to pass through to the fire departments. So what is that?
It's about 2.3% of our collections.
Total. Yeah, so
about $60,000 a month or something like that.
Right.
Basically, distributed between all of them. Okay, the second bill on March 26, just a couple of days later, Senator Bob Rousseau from Mecklenburg County introduced the Senate Bill 608, Simple and Fair Formula for Sales Tax Distribution. And this bill, also like the first one, is in the Committee on Finance. This bill was introduced to hold us harmless. It would put us back, we would be guaranteed to get the same amount of revenue we received in FY14. So that would, and with that being in mind, they would keep the county sales tax funding, like I said, at 14, and then then we could use our own distribution method for that piece. But the growth would be based on a per capita distribution method, the growth from then on. After receiving the distribution on that per capita, the increase, we would then be able to decide if we wanted to distribute it ad valorem or per capita. So that's the difference in the first bill and the second bill. That increase that we're going to hold harmless for the first part, but any increases from FY14, then we'd get that based on per capita, but then we would have the choice once a year, the county would have that choice whether to distribute it to the cities based on per capita or ad valorem. We've always checked it once a year to see, does it benefit the county to be on the ad valorem basis or the per capita? The county always has a higher percentage on ad valorem. For example, this year we had 67% that we're getting to collect. It would have been 58 if we would have been per capita. And the cities would benefit and the counties would go down. But we do that calculation once a year to compare them. So that's the difference another difference between the two bills. And I have a table in your notes there too that compares this second bill. For this one, Cabarrus County would only lose like 1.2%. So that's about 0.23 cents on our tax rate. So that one we're going to fare better if that's the road we go down. It says, however, holding us harmless at the FY14 level does not account for the loss of sales tax growth or base. That doesn't incorporate that. It's going to keep us, like I said, it's going to keep us at the 14, but all that growth, we're losing out on that, how much we would have gotten. So it sounds good, a little bit better than the first one, but we're still going to lose out. I know this is a lot to take in. I've tried to give you the snapshot of some things on the page. I'm more than willing to give you my notes. I can pass that out to you. It has a little bit more in it, but and I will definitely pass along information as we receive it. But do you have any questions right now, or anything you'd like for me to research further and get back with you at the next meeting or next month? But right now, both bills are in their finance committees and being discussed, but we haven't received any other additional updates.
Hopefully, we didn't totally confuse you more, but we want to make sure you had some of the information, and especially to compare the two. I think from the staff perspective, we hope that nothing changes, but if something does change, then we would advocate for the Senate Bill 608. That's the least amount of impact to the county. So,
I have a question. Do we know where our legislators stand on this particular bill, these bills?
I do not.
I do not.
No. You know, we had some discussion, I think, when we had our meeting with our local delegation. Only the first bill had been proposed at that time. I think the second one has happened since then. You know, that was going to be the item that I was going to ask Susan to do further research on, was to come up with an explanation of why our folks in the Senate think the way they do. If you could answer that question. But we do not. We will be going to Raleigh on Wednesday for our county assembly. Certain that this will be, we will attempt to meet with every member of our local delegation, and this will be one of the questions that we will ask. Of course, at this point, we don't even know which bill might go over to the House.
That's correct.
Based on this information, so it could be either, or it could be neither.
Could be both. Both could go over and see which way the House, I would presume.
Right. Yeah,
So which one
it's
comes out of committee, I guess.
very much up in the air. Other questions?
Susan, could you explain the hold harmless portion of this, 608?
The 608. To lessen the impact, the Mecklenburg County, Russo, came up with they wanted us to be able to keep that base that we've earned all these years. So they wanted us to keep at least the amount of revenue that we collected through FY14 or as of 14. So you're guaranteed. For example, we had, I think, hold me to it, like $30 million. Let's just say $30 million. We will be guaranteed that amount of money each year, and then like I said, the growth, which we always have growth. This year we had 10 and 12% growth, which is a phenomenal year. But that growth, we wouldn't be able to get that on the ad valorem basis. It would be per capita, which we would take a huge hit on that. So where we count on that revenue increasing, if you'll look, when you get your 5-year plan in your budget, you'll see where we've projected out each year, growth in that sales tax. That's going to change if these bills pass. That'll dramatically change our future outlook, our ability to fund schools, fund infrastructure here at the county too.
You're right. This could have a major effect on county finance, simply with this being the second largest of our fund sources. And it definitely could be detrimental, to the county, especially when it comes to having to, not saying it would come to that, but if you had to, a 3.2 cent on the tax rate increase just to cover this loss if they do Senate Bill 369. But I'm hoping that when we get to Raleigh on Wednesday, we'll be able to talk to the legislators and see if we can't help them see the way we see things in Cabarrus County.
Okay, other questions, commissioners? I would, add to what Susan has said. I mean, it is absolutely correct. We did not get in this position by accident, and there have been significant investments by the county and specifically the municipalities that have put us in a position to have this type of sales tax revenue. And I think the most important part of what you said was they are taking away our incentive to make additional investments.
Right.
In that regard. I sympathize with the fact that there are counties in North Carolina that that are experiencing shrinkage in their population and their revenue base, but I do not think it is appropriate for counties like Cabarrus and Mecklenburg to be penalized because of that. With the growth that we see in Cabarrus County from a population standpoint, also contributes to that sales tax growth. But everybody in this room knows that that comes at a great cost to us with the capital investment that we have to make for schools,
Right.
Increased law enforcement, et cetera, all the things that come along with population growth. So this is what helps us to bear part of that burden and to expect our taxpayers to pay an increased tax rate to cover the losses in other counties just is not fair, in my opinion. And it is very disturbing to me that folks at the state level would enact this type of policy without being honest with the public and telling them this is our way of increasing your taxes by forcing the counties and the municipalities to do it for us. So it is a serious problem, I think, and hopefully it will not pass. But if you look at this chart where it compares the years, it's a municipal problem as well as a county problem. In that second bill, you see red ink on every single one. In Senate Bill 369, there are a couple of actually 3 municipalities in Cabarrus County that realize significant increases. But then you look at the city of Concord gets a 10% decrease. The county as a whole gets a 16% decrease. We lose on either of the two proposals. One's just slightly better than the other one. Please keep us up to date as you get additional information, and we'll try to stay on top of it as well.
Sounds good.
Thank you. Okay, next up is construction and demolition landfill operation update, and we're happy to have Kevin Grant and Kyle Bilfer with us today.
Good afternoon. It's been a while since we've discussed operations up at the landfill, and especially what I wanted to discuss was the public-private compost operation, and disappointed to report that AgriMatters, who was our private partner, has ceased operations up there. Primarily just did not receive the amount of yard waste that he expected to see to keep it going. So just wanted to report that. We're still receiving yard waste from the city of Kannapolis under the agreements that we had with AgriMatters. So we're receiving $15 a ton, which is covering our processing costs. Other things that have resulted from this is we've still maintained the facility. You can kind of see from the aerial map there, that's from late September of last year, that we still have a compost facility that was constructed by AgriMatters that we've inherited. So it's a good facility down there. Still has all the stormwater measurements in place, and we're still using it as we speak. We've inherited the Type 1 compost permit, as well as the Type 3 permit to construct and to operate. So that's an advantage to have, and it's something to discuss going forward. What we want to do with that, if a private entity wants to jump into partnership with us, or whether we go at it alone. Right now, it probably makes sense just to stick with the Type 1 composting, which is actually just taking yard waste and just putting that into windrows or long piles, as you kind of see from that map there. Just getting it up to temperature to break it down, and then just to do a rough screen and then sell it as mulch to the public. That's what we're currently doing right now. Like I said, the good news, I guess, if you want to look at it, is we've got a facility down there that we can expand into. A couple things with the dynamics with the food waste right now that wasn't there 18 months ago, was one fact was that Wallace Farms in Charlotte, the consensus was that they weren't going to get their permit renewal to take Type 3 composting, which is actually, and I should go back and say, Type 3 includes yard waste and food waste, pre- and post-consumer food waste, everything short of biosolids and items like that. So we were really looking for a place within the county to have this and to do it there. It does look like Wallace Farms does have their permit renewal for Type 3. The other dynamic that's still to be seen is that there is a facility in Charlotte that's broken ground on food waste digestion. It's an anaerobic process. What they do is basically it's a rapid compost procedure, and as they break it down, the methane gas is used to produce energy. So that project is ongoing. The big thing there is they've stated that they need 400 tons of food waste per day to make this happen, which is an awful lot of food waste. And that could have seriously hampered our Type 3 food waste composting efforts here. So there's some issues going on with that, but like I said, right now we're still working with Kannapolis, still having discussions if they want to get involved with us in terms of contribution, either with money for equipment or labor or some sort of fashion, and we'd like to do that with Concord as well. I still think it's good to have a municipal facility to receive food, or not food waste, but yard waste, and to compost that and to provide mulch. I think it's something that we still will need in the future. With regards to the C&D landfill operations, as you can see up there, we recently expanded and received our permit in September of last year. The incoming tonnage has remained steady at about 16,000 tons a year. So that's been going well. We're currently doing an airspace analysis, which is basically taking a snapshot of what's been filled already and then using that versus kind of envisioning what the hill would look like when it's finished, and taking the subtraction there, telling you how much airspace or how much room is left to put construction and demolition waste in the landfill. Our current projections, we think, will take us out to June of 2017 with that existing expansion. I'll know more in about 3-4 weeks in terms of exactly what that number is going to be. Another option we can do as well, once that's full or within the next year, is decide to expand a little bit into the south or kind of take some of that compost area there that we may not need if we decide to go at this project ourselves. We most likely probably could do another 2-acre expansion, which could buy us another 4 or 5 years of capacity for construction and demolition waste. The other thing we're also looking at is making that facility strictly construction, demolition, recycling center, which would mean taking waste such as wood and have it segregated so people bring in wood, concrete, and shingles, and then selling that off to different marketers so it can be reused or recycled. So those are some options that we're starting to look at. Like I said, disappointed that the project didn't go. I'm surprised that it didn't get this far. I was a little concerned about the food waste portion of it because it was going to be a difficult endeavor, but from the yard waste, like I said, I'm very disappointed that we could not make this happen, but I'm still still going to push forward and see if we can make this happen in some sort of public-private venture. Like I said, that's about the summary I have. One thing I wanted to discuss as well is going forward, part of the budget, the tipping fees are currently $37 a ton. That's $35 plus a $2 North Carolina tax. I'd like to bump that up $2 to make that $39. Part of the reason is to kind of keep up with the private construction and demolition landfills in the area. They're currently around $40 to $42 a ton. I don't want that gap to get too big. I want to stay kind of with them, but I still want to provide our residents a discounted rate to bring C&D to them. The lower amount of C&D, meaning under 500 pounds or short of 2,000 pounds, would still be at the current rate, so we wouldn't change that. So for most residential customers who come in bringing construction demolition waste, that price would not change. I'd like to use some of that revenue, if we have to purchase composting equipment such as a tractor and windrow turner, especially if we're going to continue to do large type composting on ourselves. I think that's basically what I wanted to cover this afternoon. Just want to know if there's any questions, comments, or concerns about our activities up at the landfill.
I think, as you know, the landfill is set up like an enterprise fund. It's not part of your general fund. It's set up, the fees pay for the process and pays for the expenses. One thing we are, like Kevin said, we're watching what is that airspace capacity, so that we'll keep you posted as to, do you want to continue this in the future? We would need to start that permitting process very early, or do you want to just fill up what we have now and close? So we'll be keeping you posted on what's going on there. Then again, even though we would no longer take waste at the end of the airspace availability, we would still be out there for quite a while with our closure process, and we've got to maintain wells and that type of thing for many years. So,
and if we close, that's what I'm saying, one option could be is if we continue to do the yard waste composting ourselves, and that's kind of one of the reasons why we also started that project too, knowing that the actual C&D landfill was starting to run out of life there, how to keep that facility going. So we could still continue to use our folks to do a type 1 compost, you know, maybe look into type 3 and bring food waste. I know that's going to be a few years down the road, or C&D recycling that we can get a permit for too, that would not entail putting waste into a landfill, would be, you know, putting it into segregated areas and then having folks, once we hit a certain quota, have folks come in and take it off our hands. So that is another option as well. It's just something that we need to look at as the clock continues to tick. And then, as like I said too, we probably, based on the success we had with that last expansion in terms of how fast we were able to expand it and the cost, I think we could definitely absorb another, like a 2-3 acre expansion and not hit us towards our closure or post-closure and closure cost.
Okay, commissioners, you have questions for Kevin?
Just one real quick one, Mr. Chairman, and that would be reference to you wanting to have an increase of $2 on the tonnage there. Just so I can put that in perspective, the construction containers that are brought in, that people, contractors put on site, what would that equate to in poundage?
The typical weight coming in is probably 5-6 tons, roughly, somewhere in that ballpark.
Per construction container?
Yeah.
Okay.
I mean, like I said, it varies all depending on the type of waste versus lumber versus concrete or shingles. So, but that's probably the average.
I just wanted to see what the significance of the increase would be. Thank you.
Correct. And then, like I said, we've been kind of watching the area, and Highway 49 landfill over here in Harrisburg, they're roughly $40 to $42 a ton right now. So, like I said, we've always kind of kept that philosophy that we would stay below those guys there. But at the same time, I don't want to make too much of a difference, because then I'm also concerned that obviously, you want the business, but you don't want too much, because I don't want to fill up too fast, and then we're out of time to make decisions, because then the state's going to say, okay, what are you guys doing? You're full, you're out of airspace, you got to start closure procedures.
We've seen it in the past when we've tried to re-permit that we might have left that gap too large and almost cut our throat with getting filled up too quick.
Additional questions? In looking at your fee schedule, I can't quite understand. I went out there myself with my pickup truck full of miscellaneous stuff in the back. And, of course, the first thing I did is I did not stop at the proper place for the scales and so forth.
You're one of those, huh?
Got that worked out, yeah. But then I was prepared to pay, and they said I didn't have to pay anything.
What did you have, what did you bring in? If you brought in a combination of waste and recyclables, I mean, we do offer a credit for bringing recycling to encourage recycling. So that might have been what it is.
There were some recyclable items on there that I put in the various labeled bins.
And what we do when you bring in a pickup truck or a trailer mix, I mean, we do have a fee schedule, and ideally it'd be best to weigh everything. But then we would have a line, and it would take customers much longer. So a lot of it is, based on a pickup truck, there is a set fee, and if there are recyclables, and based on the quantity, what the scale house attendant sees, that'll determine what the discount will be.
Right.
So that's probably why there was no charge for
So
you.
probably I had enough recycling to
Offset.
Offset,
cover-
yes.
Yeah.
Yes, and that's one, and in terms of that, that's one of the nice benefits that we offer the county is, as part of our franchise agreement with Republic Services, is they allow us to take the residential waste that we collect there to the Speedway landfill for no charge. So based off of that, we're charging, a very reasonable fee, and a lot of that's just to cover the transportation and maintenance costs for our roll-off truck and the driver to get it over to the Speedway landfill. So, and then, like I said, we do offer a discount with recycling, and that's mainly just to encourage folks to recycle and to segregate that recyclable material.
Well, I was very pleasantly surprised. I was prepared to have to pay, and I doubt that most county residents really realize how it's clean and organized and labeled as to what goes where on the recycling end of it. So it was a very good experience.
Thank you. That's what we strive for with our employees, is just to be as professional, make it pleasant, and trying to make it as user-friendly as possible.
Right, great. Well, thank you very much.
Thank you.
For being with us today.
I have something.
Yes, ma'am.
On the fee increase, would that come to us at the budget?
That will be during the budget time. Yes,
Okay.
ma'am.
And it's been a while since I've been out there, but you have the front section where if I'm a county resident, because I don't have the rollout cans, that I can bring my household waste and I put in the different bins. But if I've ripped out the cabinets in my kitchen,
Yes.
do I still drive all the way around to dump that? Because that's more C&I,
Yeah, that's
Stuff.
typically C&D,
or C&D, I'm sorry.
which is construction demolition. I should always say that. Yeah, because technically that is construction demolition waste.
So I don't know if you did that, because, I mean, we've done a remodel at the house and whatever, replace something and put it on the trailer and cover it with a nice tarp. When we
As you're
drive out,
supposed
it must
to.
be covered on the way out. And then you drive all the way around and back up. And it's been probably 10 years since we did anything like that. And then you throw that in the C&D versus those areas up front are more, we've taken computer monitors, old TVs. You have an area for that.
Yeah,
and
we
you
have a very nice recycling center. We collect all electronics in one area, scrap tires, appliances, what they call white goods, refrigerators, used oil, used antifreeze, used cooking oil, even oyster shells out there, because that is a banned item from North Carolina landfills, as well as your normal paper, cardboard, bottles, and cans. Now, I will say, when you're talking about the small amount of construction demolition waste, you're talking the under 500 pounds or under a ton, that fee would not change. So that's the part that I like best about it, is that for most folks who are bringing in small projects and things like that, we're not adjusting the fee for that.
A lot of what's out there is a result of the research campus being built. Is that right? And
Our big,
the old buildings.
well,
that were-
Pilotex was a big one. If you go to the further south is, I think it's tough to see on this picture, it just came out way too dark, but that area just to the south of the compost area is basically most of Pilotex where that's sitting at.
Yeah, so when they brought that
When they
out
tore
there.
that building down, yes.
Yeah, they paid a fee,
Yes.
whatever that fee was. So
Yes.
that's a lot of what you get
Correct.
in the C&D would be.
Yeah, C
more
and D is
industrial
tearing,
or
yeah, it's
commercial.
tearing down a building, so you're talking, concrete, wood,
Get a lot of roofs.
shingles, things like that as items.
Thank you.
Well, important fact that I learned today was that oyster shells are not permitted in landfill. Never knew that.
Not, most people don't know that, and we do provide a facility, because I was asked by the state of North Carolina, and they provided signage, and we actually have probably 200-gallon containers full of oyster shells, so we do get them on occasion when somebody's having an oyster roast. I think it was one citizen that was concerned that had either a Boy Scout oyster roast or something like that.
Right.
So, I mean, we do have it, so it's
And
really
what do
not.
you do with them?
It gets, basically, there'll be somebody from the state that collects it from the shoreline. They take it back and dump them into the water for homes for oysters, to kind of build
Okay.
up the oyster beds is what they use it for.
Really have learned something today. Thank you.
You're welcome.
Good road bed.
That's right. Yeah, on the coast, they use them for road beds. Okay, next up, Department Highlight, Emergency Medical Services. Alan Thompson and Mr. Lentz are with us today.
Commissioners, thank you for the opportunity to be here tonight. Our hope is over the next couple minutes, we just provide somewhat of a summary view of what the emergency medical services in Cabarrus County looks like, where we come from, and part of our future vision, if you will. Our first vision statement we established in 1998. We come together as an administrative team and really tried to capture where EMS would be in the next 5, 10, 15, 20, and 25 years. And most of our focus then was to try to identify what not only our core purpose was, but also how we as an emergency medical services healthcare provider really fit into the community, how we provided services for the community. So of course, our focus has been on the standard aspects of providing patient care, but our focus has also been on how do we promote community awareness and how do we promote community wellness. So in saying that, we realize that alone we can only do so much, but through partnerships, collaborations, and being part of a comprehensive healthcare system, we can make a tremendous impact in Cabarrus County. So our focus has been on doing those things which establishes us as part of a comprehensive system, how we continue to promote excellence on every call, how do we bring that excellence to the bedside for each patient, how do we promote a nurturing work environment, and also how we take the education and information that we have out to our citizens and out to our patients. EMS in North Carolina is well regulated and is pretty interesting in that North Carolina was one of the first established EMS systems in North Carolina, in the United States, excuse me. EMS was established in 1973. The first state EMS Act was brought into place, and Cabarrus County was one of the first to establish a formal EMS system. Cabarrus EMS has been in place since 1973, shortly after the first EMS Act was established. In North Carolina, we work within the authority of General Statute 143-517. Our specific guidance comes from North Carolina Administrative Code 13P, and this is really our operational guidelines about who we are, how we practice, where our authority comes from, what we're permitted to do, and who it is that has to approve the changes that we would make within the system. Now, from an operational aspect, obviously we report to the County Commission in what we do here in Cabarrus County, but our protocols are driven by the North Carolina Medical Board through the North Carolina College of Emergency Physicians, and they're driven under the direction of a local system medical director, Dr. Craig Corey, who is one of our contract employees here for Cabarrus County. Established in 1973, our focus has been to continue to be the best and continue to be the first and continue to be most well connected with evidence-based medicine as we go forward. Cabarrus County has a history of being the first. As I said earlier, we were one of the first systems in the state, moving away from the typical funeral home delivery of emergency medical services to an established EMS system. We started our paramedic program in 1987, and in 2000, when the model EMS program became available in North Carolina, we were the 7th system in the state to be designated a model EMS system. They have since removed that program in North Carolina, but we believe that we continue to provide that level of service and have not taken a step back. We continue to strive to put the best on the street each day. And a lot of that is because of the partnerships that we've established, the leadership that we have within this county, and then, of course, our local medical director. For years, emergency medical services and other healthcare organizations have always done things just because they can or because we have always done it that way. Our medical director, Dr. Craig Corey, and our leadership team with this county has challenged that notion of delivering care and tried to focus on the concept of evidence-based medicine. We want to do things because they make a difference. We want to do things because they affect the outcome. And we want to do things that make sense while being good stewards of what we had and delivering the best care that we can to our patients. As I said earlier, we have been on the forefront of being the first in many areas, one of the first to establish an EMS system. We were one of the first to field blind insertion airway devices called the laryngeal mask airway in the late 1990s. We were one of the first, or actually the first, in North Carolina to begin doing intraosseous procedures, which is actually inserting a needle into the chest of a patient when we were not able to obtain IV access through an extremity. And I know that sounds pretty brutal, and it was, but it did have some positive impact on patients, and they were unconscious when we were doing it. And then we were one of the first to use a procedure called rapid sequence induction. In other words, with patients who had issues with airway, maintaining their airway, we were actually able to take over their airway through paralyzing their respiratory muscles and inserting a tube and taking over their breathing for them. You saw the recent release on TXA, tranexamic acid. It's something we've been doing research on now for a few years, have worked with our state medical board, North Carolina Office of EMS, local medical director, and have now implemented those protocols. And then, of course, as part of that release, we also mentioned we were going to host a regional and a statewide training conference to share some of the lessons we've learned with other providers. And then, of course, we continue to provide advanced protocols and an advanced system of care each day. So EMS, the emergency medical services, basically what we are is we respond to people who are sick, we respond to people who are injured. We answer the 911 calls. We do so quickly. We do so with a group of highly trained professionals. Our hope is that through our training, through our response, through our compassion and commitment, is that we can make a difference in the life of every person that we respond to. The reality is that we can't save every person, but our desire is to create a lasting change for every patient that we come into contact with. Our focus all along, since the establishment of the service, has been to provide equal access to emergency medical care to all the citizens in Cabarrus County, to make sure that when they dialed 911, they had highly trained providers at their doorstep in a matter of minutes. And we've been able to do this through several mechanisms, which we will explain in just a moment when we get into partnerships. But while we provide that 911 emergency response, we also want to use our response opportunities as educational opportunities. When we respond to a citizen, for example, that may have a broken ankle or a small laceration, if we identify risk factors for stroke or risk factors for cardiovascular disease, then we try to provide what we would call just-in-time education to prevent that person from having complications with that later. We've partnered with our local healthcare providers to have information that we can share. Our partnerships with our local healthcare providers have enabled us to receive additional training. They've also enabled us to have some additional resources that we otherwise may have not had access to because we're working within a system of care. The other thing that is important is that we have a group of trained responders in this county. The general statute I referenced earlier establishes the EMS system as one system in each county. That responsibility is the county's. And within that system is every trained responder, regardless of what aspect they respond in. So in addition to the ambulance service, which is what we are, Cabarrus County Emergency Medical Service, all of the fire departments who provide first responder services, the 911 dispatchers who provide pre-arrival instructions with the Sheriff's Department, police officers who have received training in first aid and CPR, and then the emergency department at the hospital. All of those are part of that initial acute care response with one focus of improving outcomes for our patients. So we realize the value of partnerships and realize that through partnerships we can make a difference. One of the things that we've been very successful in, that you've seen some recent releases on, is cardiac arrest resuscitation. We just got a report back. We're one of the top 5 in the nation right now, and we're still driving down where we are in that numerical rating, but we're one of the top. And the question has to be asked why. Our medical director said, what is it that we're doing that puts us there? I mean, what I would say to you is we've got an excellent system in place because of the support that we have in this county. We've got an excellent system in place because of the trained first responders, the commitment that they have, the excellent hospital, and then wonderful paramedics who basically have made it their purpose to respond to these calls and deliver their best on every call. So there are a lot of things that come together. To say that we have a resuscitation rate of 82% is amazing. To say that almost 50% of those patients from cardiac arrest walk out of the hospital with minimal deficit is absolutely amazing, and it's because of a system of care that has been built over time. Additional things that we do, other than just providing 911 emergency response, is we provide specialty teams to groups like the Sheriff's Department and Police Department, tactical teams. We place medics with those teams so that in the event that an officer is hurt or a citizen is hurt, we're able to provide rapid care without delays. We provide spectator event coverage, anything that's going to be of a significant impact to the community that would impact response times and make it necessary to have on-site response. Prime example is we just spent 2 days with the Carolina Rebellion at the Speedway to where we saw a tremendous number of patients. We didn't do it alone. We provided the paramedic care while other agencies provided the basic life support care. Again, the importance of partnerships so there's not such a burden on any one particular organization. Our current status is we have 11 ambulances. We just put EMS 11 up 3 days ago, the new 12-hour truck, and it has been worked very well so far. We definitely used them out in the Speedway area this last couple of days. Currently have 8 stations. We're co-located at 4 stations, soon to be 5. And what I mean by that is that we have recognized the value, and with your blessings and your support, we have worked with fire departments to co-locate, share cost, try to minimize the burden on any one particular governmental organization. So we share stations with Midland Fire Department, with Kannapolis Fire Department, Harrisburg Fire Department, and Concord Fire Department. And soon to have another station, should be in July, August. We're close on having another station that we will share, and again, that represents a shared cost. We've got 1 non-emergency unit that is soon to be discontinued, as we spoke about at the last commissioners meeting, and then we deploy a supervisor, and then Jimmy and I in quick response vehicles each day. 116 total employees. That'll be changing depending on what we choose to do moving forward with 12 versus 24-hour staffing. And then I've already mentioned our medical director, who is a contract employee that essentially provides our medical oversight and provides us the privilege of working as advanced life support providers in the field. We are a fairly busy system compared to many others, and as Commissioner Morris was mentioning earlier, as we grow, it costs money to grow. It costs, there's infrastructure that has to be in place, and when things are happening at Concord Mills or at the Speedway, it means that we have more 911 responses, and so there's a price tag associated with that. We ran just over 26,000 calls in 2014 with an average response time of just over 7 minutes. Our focus has been to maintain an average response time of 8 minutes or less. This number has came up slightly in the last couple years. I think it's last 3 years has come from 694 to 702. So it's not much of an increase, but this is reflective of traffic, and that's the thing that we try to stay ahead of with positioning of units and deployment of our resources. Some of the successes that I had, one success I had mentioned is cardiac arrest resuscitation. Again, we continue to focus on that model because we've made a difference. Many of you have had the opportunity to attend our annual Hearts and Heroes event to where we reunite healthcare providers as hospital providers, EMS providers, first responders, firefighters, law enforcement, patients and their families with a chance to have a conversation after they survive. It's been tremendously successful over the last couple of years. And again, the numbers that we're running there, over 80% of our patients regain a pulse after cardiac arrest, and close to 50% of those patients walk out of the hospital with minimal deficit. We also have been very effective as we focus our training on AMI, which is essentially a heart attack, recognizing those on EKGs, the tracing that we do greater than 80% of the time. There was a press release in the last couple of days to where we received the Mission Lifeline Gold Award because of our efforts with heart attack patients. And then we continue to focus on collaboration with the hospital, on our stroke patient population, and our heart attack patient population, as well as resuscitating cardiac arrest. The other focus is that we've placed a great emphasis on is community education for CPR. Over the last year especially, we've noticed an increase in the number of patients that are having bystander CPR performed on them once we arrive, and that's making a tremendous impact. For years now, we've been providing, partnering with county safety and risk management to provide CPR training to all county employees. This past year, we trained just over 800. The year before that, we were close to 1,200 citizens that we trained in CPR free of charge. Some of the awards that we've received, as most of you are aware of, we've been very successful in quite a few paramedic competitions over the years. As such, we have partnered with the Convention Bureau this year to bring the 2015 Carolinas Paramedic Competition to Cabarrus County. It will be held over 2 or 3 days in Cabarrus County. More information will be coming out on that shortly. And the thing that I can say that has been shared with us so far is they're very pleased and how this is working. Basically, we provide the knowledge and the paramedic equipment, and they provide the rest. We also received the National Association of County Commissioner Award last year for an Achievement Award, and then the Ash Institute Award, and then the Gold Mission Lifeline this year, and then Silver Mission Lifeline last year. Keep an eye on one of our national peer journals. We are supposed to be having a major article released in a national magazine in the next couple months, is what we're told. And once that happens, then of course you all will be made aware of it. But the presentation's been done, the approvals have been granted, and we're really looking forward to seeing what that's going to look like. I've already mentioned some of our specialty teams as far as what we do. This is not a duty that is separate from normal paramedic duties. This is an additional duty to where our folks have voluntarily taken up additional training, placed themselves in austere environments to make sure that care is delivered in a more rapid fashion. There are numerous studies out there that show the more quickly we can deliver basic and advanced life support care, the bigger difference we can make in the outcome of patients, the outcome of law enforcement officers, firefighters, and anyone else who happens to be injured while performing a hazardous task. Partnerships continue to be a huge part of our organization, as I mentioned earlier. These are but just a few that we partner with on a regular basis. We partner for educational needs. We partner for delivery of care. We partner for communication. We partner for coverage of major events. And then we also partner with quite a few committees in the area as we offer our input. We receive input from others, and we work together to focus on how we can do things better. We work closely with our state organizations, as evidenced by what we've been able to do with the TXA protocols, and we continue to focus on how we can grow every program that we have as a model of efficiency and a model of best practice while impacting the outcome for our patients. Being a paramedic, some misunderstanding surrounding this in the general community. An emergency medical technician is about 160 hours of training. Becoming a paramedic is around 1,500 hours of training. Our full-time staff is paramedic. We do hire emergency medical technicians for a part-time basis, but our full-time staff are paramedics, and that's anywhere from 13 to an 18-month program after they've received their emergency medical technician and anatomy and physiology, depending on which program that they attend. Our paramedics in Cabarrus County are highly trained, picking up a lot of additional training. Many have gone on to get their degrees. Many have gone on to get a National Registry credential. Our average experience in Cabarrus County is just over 9 years. That number has came down over the last 3 years as we have noticed an increase in some folks retiring, as well as a few that have left to go to other organizations. This is something that we continue to address with our education, and obviously what you all are taking a look at with the public safety salary study and evaluating what those things are that are important for us to continue to do our job. Our paramedics are compassionate, competent, and committed. As we mentioned in our orientation, EMS is not something that you go to work at doing. EMS is a way of life. It's a calling. It's something that you choose as your career, that you don't choose as your job. Many of our staff also have instructor certifications and many specialty certifications. Now, looking into the future of EMS, the community paramedic program I'll mention in just a moment. I've already mentioned the paramedic competition. We are evaluating, as we have presented to the county manager, what it would look like to go from 24-hour to 12-hour shifts and why we would need to do that. We've already received your approval to move away from the non-emergency services if we get an acceptable alternative, and then, of course, the salary studies, compression, and paramedic grades. We're also looking at improved ways to do documentation that will streamline process and maximize the efficiency of our billing. In the next year, we're also looking at the addition of basically a specialty services supervisor or training officer with a focus on continued partnerships and collaboration with those partners that we have worked with for years now. Moving over to the next slide, the community paramedic program is something that we're extremely excited about. There was a paper release from the National Highway Traffic Safety Administration that described community paramedic programs as an innovative way to provide care and could quite possibly be a portion of the answer to the nation's healthcare problems. And essentially what it does is it connects paramedics with patients in their homes with a focus on directing them to the most appropriate care. The answer is not always transport to the hospital. The answer is not always a visit to the emergency department. The best answer is to promote an environment of healing in the home and then connect patients to the resources they need. We have partnered with the hospital, other providers in our community, with Ben Rose and his group with the Community Resource Connection. We've started a trial in January using our existing duty resources with hopes of a full implementation of a staffed community paramedic program starting in July. Our successes have been great so far. We've reduced several hospital readmissions. We've caught some unsafe situations in patients' houses, and we've been able to connect patients to resources that they needed that otherwise they may not have had access to. So we're really excited moving forward. about where we're going to be as an organization. We will continue to focus on the goals that we've established through years of evaluating our service, as well as the communication that you provided us. And we continue to strive to be the best service that we can be, because we realize that our very next call, could be someone we know, could be a complete stranger, but the difference doesn't matter, because the reality is that every call we respond to, a life is at stake, and we have a chance to impact that life in a positive way. Any questions?
Thank you, Alan. Commissioners?
So on the community paramedic, I usually think of if somebody's calling EMT, it's emergency or whatever. Is this somebody who would call you and you would come and then as an emergency, or is this, I'm trying to understand exactly how that would work.
The community paramedic, they would still work within our organization,
Okay.
still wear the same patch that we have, the same abilities with some additional training. But essentially, it's paramedics making house calls. So if we have a patient being discharged from the hospital, let's say that's had a high-risk procedure, that is likely to be readmitted, then we can send the paramedic out that day, help with reconciliation of medications, instructions, connect them with their personal physician, make sure that the house is safe for them to be in, answer any questions they have, and then also perform some routine tasks there. We're not trying to replace any services that are already out there. We're just essentially trying to stand in the gap in those first couple of days before home health care may come out, or if home health care is even available for that particular patient. So our hope is to, if you think about doing spring cleaning at your house, if you don't know what to do with something you pick up off the floor, you throw it in the trash can. In the medical system, if people don't know what to do, they pick up the phone, they call 911, and you end up in the emergency department. And that's not always the best model of care. So our hope is to provide good care to the patients in a comfortable place and help them be transported to where they need to, rather than in a vault 911 transport to the emergency department.
And so how will you find these patients?
Part of it is through the partnership that we have with the hospital. The other part of it is through screening through our 911 telecommunicators. Part of it is we've already taken some referrals from the Community Resource Connection through DHS, and then also our paramedics. As we respond to these 911 calls, if we identify patients with unmet needs, then we're attempting to do some follow-up visits to make sure their needs have been met.
And the only other question I had, you said it all kind of fast.
I'm sorry.
That's okay. That was good. On the education part, I was going to ask you about the training. You talked about that, the 160 hours, I think, versus the 13 to 18 months, and all of yours are paramedics.
Yes,
So
ma'am.
of your 116 employees, are all of them paramedics, or a percentage?
Our full-time staff, with the exception of 2 currently, are full-time
Full-time,
paramedics. Are all paramedics. Those 2 are in school. There were some delays with the local community, with the local community college paramedic program that we relied on. So we have not been able to get those 2 at the paramedic level as of yet. We do have them enrolled, and they will be finishing sometime this year. And then our part-time staff, we do engage a lot of emergency medical technicians, but we don't mind that because they're always with an experienced paramedic. We get a chance to train them to the Cabarrus County standards, and as they go through school, they're working with our organization and have an opportunity to do clinical within our organization.
And my last question is, when you send a truck out, how many how many people are on the truck?
2.
Okay.
Unless we have a student with us, we do serve as a clinical site for several colleges, several community colleges and Concord High School. So if we've got a student with us, then there will be 3 on the truck. Now, depending on the call, cardiac arrest, for example, we'll send 2 ambulances to a cardiac arrest. So, and then you've got the first responders that respond as well. Any emergency call, and that's one of our most valuable resources, are those first responders in the community that can be on the scene in a matter of minutes. Your ambulance is on the scene in less than 8 minutes. That system together is what's making such a huge impact. So what you're doing with these volunteer fire departments, city departments, makes a big impact.
Other questions, commissioners? Thank you.
Thank you.
Thank you for what you do all the time. We don't, as I said the other night, we don't like to see you pull in our driveway, but when you do, it feels good that we know what a good job you do.
Well, thank you for support.
Thank you. Okay, next item on our agenda, we move into discussion items for action at our May 18th meeting. And first up is Active Living and Parks, and Londa Strong's going to talk with us about a lighting project.
Just want to share a little bit of additional information with you in addition to what is on the agenda item. This is a request for the occupancy tax funds that come to Cabarrus County for lighting at Rocky River Elementary School. There are 7 fields down there and 5 are lit, currently lit. Those 2 additional fields are what this is in reference to. I know you all receive a lot of information about numbers of teams that come to Cabarrus County for tournaments and spend the weekend or the day or days or weekends or whatever. Notice the numbers in here, 35 tournaments scheduled for Top Gun. This is in addition to the Youth League. The Hartselle Youth League utilizes this facility for their recreation practices and games. Now, granted, they wouldn't need all 7 fields lit. There aren't that many teams, but they do also use that facility. With those 2 additional fields being lit, you can see the number of additional teams that would be able to come to Cabarrus County. This weekend, there is I think it's 115 teams coming to Cabarrus County for a girls softball tournament. Part of them will have to go to Locust, going out of the county. I know that's not that far, but they would be able to stay in Cabarrus County if those fields had lights currently. So that happens every week. Well, not every weekend, but a lot of weekends that happens. So that's what this request is for. Commissioner Shue may have some additional comments because we've met a couple of times, and please feel free to add anything that you would like.
Mr. Chairman, I don't really have a lot of questions, but I can make a couple of comments, though, because I did talk with Donnie Broom about this particular item, and I think it was 118 teams that he had this last weekend.
118.
Yeah, 118 teams that come in, and of course I don't know how many. I know of softball or baseball usually has 9 players. You know, I said, well, what does a team consist of? And to try to wrap myself around the numbers and the economic impact that it brings to Cabarrus County. And most of these teams consist of 15 players. But when you take the 15 players and you add the mom and the dad and the siblings and aunts and uncles and all of that, it composes a lot of people that come to Cabarrus County per team. And Donnie was telling me this morning that he talked with a gentleman. He was one of the coaches, and he was from Virginia. He brought his teams from Virginia here, and he asked Donnie, he said, will you come out to my car? I want to show you something. And Donnie said, well, yeah. And he took him out, and he showed him some things that he had in his car, but Donnie asked him, well, where are you staying? He says, well, I'm not staying in Cabarrus County tonight. And he said, well, why would that be? He said, well, there's no rooms available. There's no rooms available, you know, in this immediate area, so I'm just going to drive back. And, you know, by putting these lights on these 2 extra fields will give Top Gun Sports obviously more playing time because they'll have those 2 fields that they can play. I would say 2 teams or 2 games per night that they have those fields lit. And over a course of, I don't know how long it would take to get the economic impact to, you know, cover the costs like this, but it's really, in my opinion, it's really a Band-Aid right now because it is giving us more playing fields. But I know the county manager and I, we've talked, and some of the others with Active Living in Parks, that we just don't have enough ball fields in Cabarrus County to cover all the play that is coming and will continue to come as the county grows. But this, for sure, though, will give them more playing time and hopefully keep quite a few more of the people that travel here from out of state. You know, they can stay here, spend the night, that type thing, and they can accomplish a lot more, I think. So I think it's a good thing that we do this, and I'm hoping that as time goes on, we'll be able to, at some point, provide more fields for these teams that come here, because it does have a tremendous economic impact to Cabarrus County.
There are, I'm sorry, I don't remember the exact number. Ms. Dubois, do you remember of how much money is in there? You sent me that info and I didn't put it in here. 800? Sorry. I'm sorry. $648,000 is what's in that account. Thank you.
This money is collected through our contract with the Convention and Visitors Bureau. This is an occupancy tax. Through our contract with them, we are able to keep 5% of that money for the improvement, enhancement, development of our parks for the purpose of improving or enhancing our tourism efforts. So this project definitely falls within that category. Some of the other things we built, the restroom facilities out at the Rocky River. We built, we purchased pitchers mounds that we could use on all of our fields, so that they were available for multiple uses. So this definitely falls within that category, and we support it. And there's additional money in there that we may be coming to you in the future for additional projects. But one thing, it will continue to accumulate as long as our contract is currently in force. So.
Additional questions? Well, I'm glad you pointed that out. I think there may be people that could be watching this meeting on television at home that would ask the question, why are you spending $155,000 on lights for ball fields when you could be spending it on an additional ambulance, or you could have a whole long laundry list of things? And by statute, by law, we are required to spend these funds on tourism promoting activities. These are funds that are collected from people outside of our community that come here to visit and stay in hotels. So I would say the folks over at the Carolina Rebellion this past weekend made a significant contribution to recreational facilities in Cabarrus County over the long term. Does anybody else have questions? Yes, ma'am.
I just wonder if you have any other requests from any other parts of the county?
Currently, we do not.
Okay, so you're not, this is not a
not at
competitive
all.
situation?
Thank you.
I was going to say, as you can see, the project ordinance and budget amendment were not available at the time for the inclusion in the work session, but I was working with Susan, Ms. Farrington, on that, so she will have those.
Great. Thank you very much.
Thank you.
Okay, next up is funding requests for design and construction for Cabarrus County Schools, and we're happy to have Tim Louder with us.
Thank you. Glad to be here. As you may know, the Cabarrus County School Board voted on April 13th to locate the replacement of the Royal Oaks Elementary School on the Royal Oaks site. And in doing so, now we have a goal to move forward. And at this time, we're requesting the funds to the tune of $950,000 for the design, construction, administration services for that replacement school as we begin this design process. Currently, we are in negotiations with the Mosley Architecture out of Charlotte, North Carolina, to be our architect for this project. And we just finished red lines and came back yesterday, so the attorney should have those finalized very shortly and probably be in front of our board at our next meeting next week.
Great. Commissioners, do you have questions for Mr. Louder? We've talked a great deal about this project as we have moved along, and welcome.
Thank you.
I think this is your first time meeting with us in your new position. We're glad to have you on board.
Glad to be here. Thank you. And I'm just glad to get this decision made so we can move forward with this project.
And let me say, too, I served with him on the Board of Education, so he has that point of view about schools and school construction as well.
Trying to keep remembering that one night.
It was very enjoyable.
Hey.
Just as not part of this budget amendment, but what was the decision about the number of students that this school would?
It's going to be a design capacity for 648 kids with 800 core. And I do have no logical explanation why it's 648 not 650, but anyway, that's the number they came up with, the 648 versus 800 core. That will be about 300 students more than exists on the site right now. It's about 350 students at Royal Oaks.
Tim, just for the information for the viewing audience, when does this school supposed to open?
This school will open we talked about a mid-year opening of 2017.
Okay. Additional questions, commissioners? Thank you for being with us, and I think we might have another item you may be involved in. We're going to move item 4.7 up to be next, which is Cabarrus County Schools, Odell, grades 3 through 5 elementary school, budget reclassification, and I think Susan is going to join you on that one.
Well, here we are.
This agenda item is mainly an administrative type item. Back at the mediation settlement, there was a $2 million settlement for the Odell School, and we, in finance, put all that into the construction line item, where in fact the schools would prefer $300,000 to be in the technology and 1.7 in construction. So this budget amendment will correct that administrative and get that right position on our books, so our books will match. We found this by reconciling the school's capital outlay to our capital outlay in the past couple of weeks. We could locate this difference, and there was another one too where we had placed some items into the construction when we should have left them in the get this right, the site development. Thank you, the site development line item. So this will correct those issues and put our books in line with the schools. It's more of an administrative type budget amendment.
And that was for the demolition of the Odell School, to which I took the money and put it in the construction line item, forgot to leave the money behind for demolition.
Okay. Do you have questions, commissioners? Thank you very much.
Thank you very much.
Okay, next is 4.3, proposed exchange of property on Rankin Road, and Jonathan Marshall is going to talk with us about that.
And I'm not sure if Mr. Fischel is here, but the property owner? As much as Mr. Fischel and I have talked, so to speak, by email and phone, this is the first time I've met. It's good to meet you.
It's a pleasure, thank you.
Mr. Fischel is the owner of a piece of property at the end of Rankin Road that actually, when it was purchased, there's a piece of property in between. It's two parcels essentially, with some property in between that the county owns. And well, Megan Ghost said I'm actually going to use the microphone and walk up since pointers don't work real well. So Mr. Fischel's property is actually, this is Rankin Road. He owns a parcel that runs on Rankin Road on which his dwelling is located. This is county property in between, another property owner to the north. He also owns a little over 51,000 square feet of property that lies to the east and is inaccessible without crossing the county property or going over someone else's land. Along the frontage of Rankin Road, the county owns the land to the south of them. So the proposal here is that...
John, you turned it off.
Hi. So the county owns property going down Rankin Road. So what we're proposing is to exchange some property on Rankin Road and equal amounts for that property that he owns that's inaccessible to him to the east. If you go to the next map, please. Well, may have been the previous map. So again, this is the parcel that Mr. Fischel owns. This is actually, again, county property. The lake surface itself is at 650 feet above sea level. We like to maintain a 150-foot buffer around the lake. So that buffer is this dashed line. As you can see, it crosses part of that parcel we would be exchanging. So we'd actually gain some of what we consider critical buffer area. The parcel that we'd be exchanging would be entirely outside of the buffer area. So one of the questions, I presented this to the Water and Sewer Authority Board. They had some input, but I think by general consensus, and Commissioner Poole may want to comment on this, agreed that this made sense, but one of the issues was, what does the county gain from this? Well, we gain some of that critical buffer area that we like to retain around the property. And then the second part of that is a matter of fairness, that Mr. Fischel has the same amount of property, but now accessible to him on Rankin Road, rather than a piece that's to the east and inaccessible or less accessible. And I don't know, Mr. Fischel, if you wanted to add anything to that.
No, and that's the biggest thing. When we first bought the property, there was an access road that ran around. But since then, they've actually built a dwelling. So to do that same access to my property, I'd actually have to go through their front yard, which isn't, you know, very good process for getting there. And we're just trying to tie it together so the land could be more usable. There's no plans for any of the land. I still am under 4 acres, so I couldn't build another dwelling or anything there. So I can't change the way I'm using the land. You know, we're just looking to tie it together to make it more usable or more accessible.
So the statute actually allows the commissioners to approve a property transfer for equal value. We've done this on the other side of the lake, I believe it was off Overcash Road, and we had a similar exchange probably more than, I'd say, 8 to 10 years ago. But so it's not unheard of. Again, there's a little bit of benefit to us because of that critical buffer area, and I took it to the Water and Sewer Authority Board for their review, since they do maintain and operate the reservoir for us.
Yeah, and I'll just agree with Jonathan. Because as I'm a member of the Wasatch Board, so is he. So it makes sense. I mean, you've got a landlocked piece of property that is of really no benefit to you, but it is a benefit to us. It's very important for us to make sure that the shoreline is protected, since that's our source of water. And as you'll notice, there's the stipulations in there that no additional clearing of county property, and that, as he's already said, he can't put another house on that property. So to me, it seems like it's a logical thing to do, and it's a nice, friendly thing to do too. I mean, then that's how we should be. We should treat people fairly, and since that was brought to our attention, that's why the Wasatch Board supports it.
Great. Commissioners, do you have any additional questions for Jonathan or Mr. Fischel? Thank you for being with us tonight. Thank you.
Thank you.
It's good to meet you.
Okay, next item on our agenda is Urbanized Area Formula Program Resolution, and that's Bob Bushy and Ben Rose to talk with us about that.
Good evening. This agenda item, I'm going to let Bob tell you a little bit about the history, but we are basically seeking authority from you to apply for some federal grants, transportation grants. And this has come about due to some changes in our classification. So I'll let Bob tell you a little bit about that history and what put us here today.
Thank you. As Ben said, Cabarrus County has been reclassified as a large urban area, and that impacts the grant funding that we receive. In the past, our grant funding has been 100% from the state with county match. That is going to reduce because of this large urban classification, and we will now be applying for federal funds through the 5307 urbanized area formula. There's a long process to get set up to be a grantee, and this is one of the processes of the resolution that's before you tonight, authorizing Cabarrus County Transportation and the transportation manager to apply for the grant funding.
Okay, are there any questions? I'm sure we could probably ask a lot of questions and get even more confused than.
I just have one, and Bob, you can probably answer it pretty quick. That is, what will be the difference in revenue from going from a state-funded to a federal government fund?
Well, we will still get some state funding. We get a 5311 admin grant that is going to be reduced $70,000 this next fiscal year. Because we are not a fixed line service, the 5307 funding that we're going to receive cannot be used for anything except capital. But they do define capital as preventative maintenance. We have never received any preventative maintenance in any of our grants in the past, so that is a positive that we can relieve some of the local funding on that portion.
That's good. Thank you.
Other questions? Thank you.
Thank you.
Okay, next item is Mr. Rose still with us, along with Kathy Maurer on HCCBG funding plan.
And this is the Cabarrus County Department of Human Services serves as the lead agency for the Home and Care Community Block Grant. And that is a process in which, as the lead agency, we organize and work with the Home and Care Community Block Grant Advisory Committee to develop a funding plan. Basically, the Home and Care Community Block Grant funds about 20 or 21 different types of services to serve our aging population. And this advisory committee will set forth their priorities in terms of how they would like to take our grant and where they would like to allocate those funds. And Kathy probably has more specific details on what the advisory committee has chosen, and then, and of course, this will be a plan that is subject to your approval. So I'll let Kathy talk about the details of the plan.
Home and Community Care Block Grant, which we usually refer to as HCCBG, basically is providing services for individuals that are 60 or over under the Older Americans Act. And some of the services that we provide are what the committee has determined. I'm sorry. I apologize. I'm sorry. The committee, basically, as Mr. Rose said, there is the option of anywhere from 20 to 21 different services that we could consider. And the task for our advisory council is to look at those services and then determine which services they feel that our county most needs. And this year we looked at those services consisting of transportation, adult day care and adult day health, in-home aid services, home-delivered meals, and senior center operations. And those services are being provided, of course, by us at the Department of Human Services, Active Living in Parks, Planning and Development, home repair is another one that we chose, Planning and Development, and then, of course, Cabarrus Meals on Wheels. The funding plan that you have before you at this point is the numbers that we had from the previous year. There may very well be a possibility the state has not given us the final numbers, so there may be some changes going forward, but we have been directed by AAA or the Area Agency on Aging to use last year's numbers to be able to see what we wanted to do with our funding plan this year. They did also share that last year we incurred a 3% reduction from the state, and we have learned that 3% will be an ongoing reduction. So we will anticipate that will occur again this year. Whether that will occur with the funding at the first year when they send it out to us or later on, we're not sure right yet.
We're trying to figure out, do you have this in front of you? Because I don't have it.
Yeah, it's on page 105. It's at the end. Can I ask a question while you're
Yes,
looking for
sir.
that? On the home repair, how does, if somebody needs that, what does that mean? I mean, like, for example, I know of somebody who needs a handicap ramp.
Okay, that would be something that the Planning and Development Department would look at based on their funding. Also, I think they do some weatherization as well.
So how would somebody, if they needed that, how would they go about finding if funds were available?
They would contact our Planning and Development Department here at the county.
Because they would just be able to walk them through that situation.
Right. Yes, they would.
I was literally asked about that last week. It was somebody
Yes.
that had tried a couple different avenues, and they had been suggested that they did a reverse mortgage, which was not something that they could do, and they're in desperate need of a ramp.
Right. I might
be able to get
very
in
well
and out of
say
it.
that Ms. Sifford, she basically, if she's not able to do funding, she will contact us to see if we have ideas. She's very good about reaching out with partners. So I would recommend for them to contact either us or her so we could see what is offered as options.
So Kelly Sifford or Linda Cruz would get that process started, and we do combine it. There are some monies available in her programs, but if not, she's also used some private and nonprofit help, particularly for ramps. A lot of luck with
Telephone
that.
number. 704-920-2142 is Kelly.
That's Kelly. Thank you.
Question.
Yes, ma'am.
That leads to the next question. How does the average citizen Because here we are talking about it, and we're asking the question directly to you, but how does the average citizen out there know that these things are available, no matter what the scope is? I mean, how is that conveyed to the public?
Okay,
so
a lot
that
of
they
it
know
is,
these things
okay.
are-
We do outreach in our community to local organization, churches, anyone that has a request. I'll either do it or some of my staff will do it. Also, the publication Sunset Outlook that's prepared by Active Living in Parks, they list all of these services in there as well. So we try our best to get that out to the public. If the public happens to call into our office and is inquiring about a need, then my staff then, of course, works to connect them not only to these services but any other that we might have or the community might have.
When you say you contact the churches, do they get a regular listing? Or, I mean, how?
A lot of
I've
times-
never seen it in anything from my particular church.
Okay, a lot of times we have churches that will call us and say, will you come out and do a presentation about our services and things? The other thing also, we are, through the Community Resource Connection, we are trying to make those connections with our private provider agencies so they can make those referrals into us when they have individuals that are inquiring about the services. But we try to get that information out to the public as much as we can. We are also starting an effort with our local libraries, with the director of the libraries, trying to make sure that we can get our programs connected in the libraries, because that's where folks come in a lot. So we'll be doing some publicity there as well about services and those things that we do.
Is there ever anything in the newspaper? An article in the newspaper?
Have not. That may be something that I need to explore. We've not done one recently. A lot of times we'll do some news releases for certain programs at specific times, but not just an overall general kind of informational thing.
And just for a little clarification too, some of these funds, of course, are going to existing agencies supporting their services like home delivered meals. And what Kathy referred to as the Community Resource Connection, that is an endeavor that we have been undertaking over the last quite a few years, but really the last 2 to 3 years, where we've really grown it, where basically this is an avenue in which we are connecting our citizens with providers. They will basically call in and say, I have this certain need, and we can take that need and put it out to a resource of private providers, nonprofits, and basically they can say, based on that need, my agency can help meet that need, and we will connect that client to that resource. And that's what Kathy was talking about the Community Resource Connection. It's really been something that's been growing over the last 2 years. We're very proud of it. We continue to develop it and massage it, and we're looking at ways to make sure that there's easy access to services with our aging population, and they can get the information they need and get connected with a person or agency that can help them.
So that really, I think, is one of the great values of this community resources, is that there are so many different places that people interact with us, but by connecting those places, we're making sure we're not missing something. And the community paramedics is going to be another example where they may be able to identify a need in a home that we can meet with one of our other programs and then pass that need along to us.
Any additional questions? Thank you. And while you're up here with us, Mr. Rose, if you could give us a little information. Several of us were very pleased to participate in a recognition event Friday morning, and so if you would just kind of update the public on that.
Sure, we'll be glad to. Yes, and thank you, Mr. Morris, for coming Friday, and for Ms. Poole. We had a recognition event for our Economic Services Division. They have, as you know, and historically over the past 2 years, we've converted to a new system in CFAS, and it has presented many, many challenges for us, that coupled with the Affordable Care Act. And of course, some of the challenges that we've been having, and the state has been having, it's not just us alone, it's the state, have been getting our work process on a timely basis, both in the food and nutrition program and in the Medicaid program. And of course, our primary role there is to determine the eligibility for these services. The challenge that we had last summer was the Affordable Care Act put over 100,000 Medicaid applications statewide to us, and of those 100,000, we had about 8,000 of those. So at the time, the state asked us to focus on Medicaid applications because we had to get those processed. They feared, legal issues from that. So we put all our resources towards that, and the state was able to, while we worked on that, they were able to get a waiver which basically would extend Medicaid benefits to those already receiving Medicaid. And if you receive Medicaid, basically once you become eligible and you receive Medicaid, there's a time period, usually 6 months or a year later, that you have to go under the review process. And basically all that is the state sends out, it's time for your review. We take a look at the client's situation to make sure that they're still eligible and continue to receive the benefit. Or do we need to make changes, or are they no longer eligible? So basically what the state was able to do was to say, while you work on these applications, when those reviews come due, if you don't get it done, the client will not lose their benefit. It will just continue into the next month. And then if you, at the end of that month, if you are not able to get it done, it will continue. Well, as you can imagine, as the state as a whole, we're working on the applications. Well, these reviews are building up each month. And in our county, it's probably anywhere from 1,200 to 1,800 a month. So here when we hit January and we got our applications caught up, the state had over 250,000 Medicaid reviews that were not timely. So the state put focus on that and said, we got to get these done. The original deadline was April 30th. They extended that deadline to, or March 31st was the original deadline. Then they extended it to June 30th. So we put our focus in January on getting Medicaid reviews done. Here in our county, we had at that time about a little over 12,000 that we had that were untimely that we had to get done. So through a lot of work and planning with management, myself, Diane Gridley, and her management team, we worked on strategies, and we were able to knock those 12,000 out over the course of the next 4 months, and we are now current on all our Medicaid applications and reviews, and we celebrated Friday morning, and it was a wonderful celebration. And thank you to the County Manager Downs for having that idea to do that, and for your support. The last 2 years has been a definite challenge within this area. We've faced between just not only North Carolina FAST and the Affordable Care Act, we've seen a lot of turnover. Staff have gotten burned out in this area because it's become so hard. The volume has increased. But we're at a good place now. We hope we can stay there until the next bomb drops with whatever happens with the state and Medicaid reform or Medicaid expansion or whatever we might see. But just kudos to my staff. They are tremendously dedicated public servants, and they deserve all the credit.
Thank you, and thank you to your staff for all the hard work. I think, and I'm so glad that you gave us that update. People that watched this on television over the past couple years would be extremely familiar with the many, many hours that we have spent asking you questions, talking about how we get temporary help to try to catch up backlogs. Certainly the experience that we went through with the food stamp applicants that were behind and those kind of things. I think when we were talking about this a year ago, the thought in my mind was we'll be going through that exact same process again as we fall behind. And so to hear that you're completely caught up and current is tremendously good news, and I congratulate you and all the staff members there for doing a great job getting us back on track.
And there are still over 200,000 right now currently that are overdue. So there's still a big number out there.
200,000 in other
counties. Exactly.
Yes.
Exactly.
Yeah.
So it's still an overwhelming task that counties are facing. And I think it will be a continuing issue, but we will just continue to battle it day by day and take it day by day.
Great. Thank you.
Thank you very much for your support.
Okay, next we have public school building capital. Well, let's see. Yeah, education lottery payment application. Susan Fearington. 4.6. That's right. Alan Thompson has patiently waited Yes, I apologize. Educational affiliation between EMS and Cabarrus County Schools. Alan Thompson.
What this agreement represents is just basically an increase in the relationship that we have with Cabarrus County Schools. A few years back, we worked with Cabarrus County Schools on a career technical education program to place an emergency medical technician program at Concord High School. We have supported that program with our time, with some assistance in developing the program, have worked with Commissioner Poole with the program as well. And the program has now grown to the point that the students are nearing the place where they would do clinical opportunity. And our hope is to improve the education that they get by providing some valid clinical opportunity experiences for them. So for that to be in place, we need to have a contract very similar to what we have with community colleges that basically establishes responsibility, liability, and coverages for clinical experience for emergency medical technician students. What we're looking for is just basically permission to move forward with review of this contract and to give the county manager permission to execute this contract once the appropriate standards have been met.
Any questions, commissioners?
I would just look to Rich and Mike. I assume you guys have reviewed all this and have a comfort level.
I've read it. We haven't really vetted the language of it. In the event that there is to be a few changes in it, but the overall concept is something that we've done in the past.
Yeah, I'm sure there'll be back and forth between us and the schools, I'm sure, a couple times.
The concept, no doubt, is good. Yes, great, working with the schools. I'm just interested in the financial impact and the resources. Where is that going to come? Because I was reading, this, and I seen where that the students have to provide they have to have uniforms, I believe, and there'll be some things that they'll need. Is that going to be a school funding need, or is it going to be something that EMS supplies, or which is county money? I'm just sort of confused about the revenue part to fund this.
Much of that will be up to the school system to decide how that is applied. Our history up to this point is surplus material that we've had that would have otherwise been disposed of or shared with the community college. We've been able to share with the students at Cabarrus County Schools, particularly with this program. 7 students graduated this program last year. I believe it was Commissioner Poole, seven students. And our hope with the program is to connect students with the emergency services field at a much earlier age. I'm a prime example of that. I went to the EMT program when I was still a junior in high school and tested once I was a senior. And that was an unofficial program. But now we're at that place where there are so many different careers competing for the people that we need. We need to connect these students early on at an early age so that they can start focusing on the training available through the community college and to come back into our system. So those places where we can provide surplus equipment in the form of uniforms, in the form of splints and educational material that we no longer need, those places to where we can provide on-duty resources, and those places to where we can provide clinical at no additional cost. We're still running the calls. We just basically take a student under our wing, so there is no cost for the county on it other than the liability associated with it.
Okay, any other questions? Commissioner Poole?
All of the programs have their own uniforms. It may be a T-shirt. It may be more of a shirt like you've got on. They have patches depending on which of the 3 programs are there, and that's taken care of by the school system. There are CTE funds available that have purchased the equipment that they use, whether it's the CPR mannequins or, I don't know, they've got splints. I mean, they've got everything possible. So all of that's provided by CTE department, and it is not paid for by, most of those funds are federal dollars that flow through the state that cover those. So it's not there's no financial impact on this. My only question, I guess, would be the way that this is listed in our agenda. If I go back 2 pages, it says to approve the MOU, and I don't think we're at the point where we need to approve it. this should be that we are asking for, our attorney needs to vet this document and make sure that it's acceptable. I would think Cabarrus County Schools attorney needs to look at it, and I don't know when it would be scheduled to be on their agenda. I don't know if you know that or not, but it needs to be on their agenda because it has their school board chair signing the MOU, and on our behalf, Alan is signing the MOU. So both attorneys need to look at it and make sure that it's okay with both groups, and then get it in place. And it should be, which I've read it, but I cannot remember. Oh, there's a clause in there that with a notice, it stays in effect until either of the two gives notice of, I don't know if it's 60 days of cancellation, but we've got that in there.
30 days.
30 days. So, there's student responsibilities. It's a very good document, and I think it protects everybody. But if I was a school board chair, I wouldn't sign it until my attorney had looked at it. And if I was Alan, I wouldn't sign it until Rich has looked at it. So, right. So I think that we need to change how, I don't think it needs to be on the agenda for this month for approval. I would think that it'd be a matter of a head nod today to say to proceed with it. And then once both groups have agreed to the wording, then it would come back to us and could easily be placed on the consent agenda.
It was my understanding that we were authorizing the county manager after this head nod to consult with Alan and the attorney, but we can do it.
Yeah, you can do it. I mean, that's typically the way it is you'll get the document, and then there may be some changes made prior to the signing. So they don't typically have to come back to the board, but if you want.
Yeah, I'm just saying, it just says motion to approve it, and if you haven't vetted it, I don't know that I'd be ready to approve it, if that makes sense. That would be my point.
But that, typically
maybe
that's
that's
how we
a-
handle it, and authorize the second part of that's fairly standard language that we put in there to make sure you understand that we're not going to approve it until the attorney and manager have reached the final wording.
I'm just questioning how that action is listed.
Okay, we can either change that wording to say, and authorize the county manager, or we can move it on the agenda, whatever will be your pleasure when we get to that point.
Yeah, the question is going to be, do you want us to bring it back to you after we've vetted it and made some minor changes? If it's a lot of content that we would change, then yeah, sure, we would bring it back to you. But if it's some minor things, we typically make those changes and sign off.
Could you not just put a phrase in there, and authorize the county manager after consultation with the county attorney and can't you just put that phrase in there and keep it as it is?
You okay with that? Yeah.
Well, I guess my point would be to have something in there that it would, I don't know, you can leave it like it is. I just think that there could very well be changes, and if there are any substantial changes, then
If there's
I would like to
substantial
see.
changes, we're going to bring
If
them back
there's
to
any
you.
changes, I'd like to see it. That's the only reason why I think it was.
Right.
I mean, I think that it needs to be in place, because I have a concern of a liability issue if there's students doing ride-alongs with you and we don't have an MOU in place. So it should be done as quickly as possible.
Right.
Because those seniors are needing to do ride-alongs. If they're not already, they may already be doing them.
It's my understanding that none of them are at the point of needing to do ride time, and we
We've
will
got
not allow that until the
A
contract.
month left in the semester, and there are a number of EMT2 students that would need that. So we would need to move as quickly as possible.
Who on the school board side, or who on the school side is working with this project to get it, to even get it before their board? I don't know, is that you? I don't know.
Well, it's not technically me. I mean, I think
Is it?
it would be
should
best
we,
if,
talk to Ms. Conger, or who?
I think
Alan, have you done
if
it?
you made a conversation, you or Alan, or you make a conversation with the superintendent and make sure that they've looked at it and that they're.
Okay, my
Touch base
understanding
with
was
them,
they
make
knew
sure, I
about
don't
it,
know.
so.
Ms. Conger and I have been working together for some time on this,
Okay.
and had got to a point that where we thought we had provided all the input that we could, and that it needed that next level approval to take it to the attorneys to do their final review. Much of this was already in place unofficially. The part that this added was the clinical agreement, and it's pretty standard language that we use with the community college. So all we were looking for was just to get a review by the county attorney and a review by the school board, because both Ms. Conger and I have felt we had reached a point that we had reached our level of ability to make a decision on it, and we need to bring it to your level.
Okay,
And then,
so
of
has
course, the
Ms.
school board
Conger,
level.
has she scheduled it to go on to the school board's agenda?
No, sir, she was waiting till we finished at this level.
Okay.
So can you just
needs
make
to
a
run
call
concurrently.
and,
Sure.
and
Yeah.
see where they are on scheduling it and make
Sure.
sure that both groups are doing it, please?
And it would be safe to assume that this process could take place probably prior to our regular meeting in 2 weeks. We can approve it, and then we won't have any holdups. Great. Thank you very much. Thank you. Okay, now we go back to the North Carolina Education Lottery Payment Application. Susan Farrington.
Once a year, past probably 4 or 5 years, we've come to you for you to use lottery funds for our debt service payments. So that's going to happen again this year. In our regular general fund budget, we budgeted $2.2 million for lottery funding of our debt service. So this is a chance for us to send in our applications to the DPI to get the money put into our account so we can reimburse ourselves for debt service. And I just thought it was interesting. I was going back through the information. We started the lottery proceeds, receiving them in October of 2006, and we've received over $25 million since that time. And just some of the projects that we've used that on, we've spent $13.9 million in debt service payments with that money. We've helped build Hickory Ridge Middle School, Fur Elementary, and Boger Elementary. A.L. Brown had some remodels that we used that money for, and then Shady Brook had just a little bit of improvements made to that school. So just to give you an idea of what we've spent the money on. So right now, this will take us, if you approve this $2.2 million, this will take us down to a little bit like $1.5 million left in the fund. Each year we earn about $2 million, and that's why we've got it for the next, in our 5-year plan, to use $2 million each year for debt service. So we're back to the point now where we're earning and paying out about the same amount that we're taking in each year. So questions on lottery funds?
What originally, I know that the amount that we have received from the state has declined since the beginning. What are those percentages running now?
Well, I looked back, and the maximum that we received was in 2010, and it was like $5.3 million. We're now receiving about $2 million.
Right. I think when we had our legislative assembly with the North Carolina Association of County Commissioners last year, that was the primary theme, was restore the lottery funding to where it originally was, which is another example of the implications to local government from the actions of the General Assembly, that where that funding, you said 5?
It was, I looked back, and the maximum was like 5.3 back in 2010.
5.3 million, now down to
About
2 million. So that's $3.3 million in funding that we initially were promised from the lottery that has gone away.
That's annually, too.
Annually.
That we're
And
missing.
yes, for a number of years being, so had we been receiving that full amount that was originally promised, it would have gone a long way towards handling debt service on school capital projects that we have incurred. Does anybody else have questions or comments?
I have a comment. I totally agree with you on your analysis that this is just another way to redistribute the situation, because the people that need this money the most are the ones that are growing and thriving, and they just keep cutting and cutting and cutting. So we're being forced, as you said, to do something locally in order to make up that loss of revenue. We have to have it.
And that's some of the same concerns with this sales tax bill, is if they'll do it with the lottery funds, they potentially can do it with this if it all becomes a state tax. And they will.
And those of us, as you just pointed out, that really need this funding to pay the cost of growth and the cost of new school construction are the ones that are being cut.
And unfortunately, there's fewer of us than there are of them.
That's right. You're exactly right. I think the last report I heard, of the 100 counties in North Carolina, 20 were growing and 80 were either stable or losing population. I think I'm correct on that. Any other questions for Ms. Farrington? Thank you very much. Okay, next item is Board of Commissioners action plan based on retreat discussions, and that looks like that's Jonathan, Mike, and Pam.
Yeah, I'll just introduce it and let Jonathan take on. The actual drafting of that document that we're moving forward with. Again, this is the input that you gave us from your retreats that was captured by leading and governing associates during the 2 retreats that we had there. So we took that information, and as you remember, it was on several focus areas. Actually, it was ended up on 3. And we took that and met several times, and we actually, based on what was said, what was captured, we actually created a 4th focus area, which was communications. We thought that you had made enough comments and thought that it was so important that we thought that it deserves its own focus area. So what we've done is analyze that. Jonathan has put it back in writing. We've divided it up, offered some optional amendments to your current goals. And this is really a discussion to make sure we're on the right track, because we are budgeting accordingly now. We've moved, we've enhanced, we're looking to enhance programs or spend more money in certain areas simply because of what the feedback we got from you. So we'll turn it over to you, Jonathan, and you can talk through it, and then we'll have a discussion.
So included with your agenda is the first draft document, and I want to assure you that from this point forward, any changes I make to it or that we make to it will be in revised text format, so you'll see any changes, since this is ultimately your action plan. As Mike said, it follows this series of retreats that you held with the municipalities, the county department heads, the boards of education, and then your own internal retreat. And then, of course, now you followed that with a retreat with the business community, and then your second summit with municipalities. I actually have notes from the last 2 that you did with the business community and with the municipalities that I think will make some changes to some of these recommendations. So you'll see those again in a revised text format as we make those. A couple of things I want to point out as I go through the different parts. You were provided with from your internal retreat, the day we spent in here with our facilitators, and they covered these walls with points you made on all these focus areas. I used that, and then we all reviewed them as a staff to help formulate this. You will not see everything you said in here. Some of those are it is a strategic plan. The difference between a comprehensive and strategic plan, of course, is you are hitting the most important, or we're trying to hit the most important items, with the idea that by doing that, those other items will also improve, or you will still be focusing your efforts on the highest percentage of what you identified as important. So that's the idea of this strategic plan. The other part of that is that as you go through your budget sessions and as you're going through the budget and reviewing that, each one of our departments is tasked with providing their own highlights, objectives, and goals and ways of measuring those. So there are many things that are taking place within each department that we won't repeat here, but are part of your overall plan. Because when you're adopting that budget, you are adopting a plan for how not only are the community resources being applied and the money spent, but that is by their work plans that they include in there, the way that you're approaching the needs that have been identified and their objectives. As Mike said, I'm going to go through the parts, but the first part is just an introduction, kind of repeating that. There are 4 bullet points that come almost directly from what the facilitators had provided to you as the kind of the working method of approaching this, and what you were trying to achieve in that internal retreat. We did concentrate on 3 focus areas that day, but the concept of communication, and that's really a back and forth communication, which I think is essentially what all your retreats and summits have been. It has been a back and forth discussion where you're hearing from all facets of the community getting information back, and you are in turn responding to that. So the communication became very important. I think, in discussions with Kasha and David, there are many of our programs and many of the things we're doing that are already set up to achieve that goal, and we can work on some of those things you've identified within those work processes we've had. But we've also seen, as we've gone through our budget, by that increased emphasis, the need that we may need to put more resources forth in that particular area. So the first part, again, is really just a kind of a summary of what the rest of the document is going to be. I've divided each one of these focus areas into today, tomorrow, and then who, how, and what. Those were our discussions those days, and that when we sat here for the internal retreat, we talked about today, things that are going on now, things that are the issues and concerns. Tomorrow began to get at that idea of how do we start to address some of those issues? What needs to take place to begin to take those on and provide our resources in order to properly address them. And then finally, the who, how, and what was some at least initial stages of what we would do to address them. So it goes through with the transportation, connection, and mobility. And again, if you think back to the first municipal summit, these all have connections. So that first municipal summit, we had individual tables and people came up with ideas, what they thought were important issues, what were important concepts. We began to present those, they began to put them together and hone those and focus them. And that's where these focus areas came from for our facilitators, is they took that initial summit and work by a very broad range of the elected officials and staff in the community and provided you these focus areas for your discussion and your retreat. And then your comments that followed that are what are summarized here. And again, you have that document from the facilitators to compare that back to. So if you see something you feel was really important that came out that day that is not captured, that would be a great example of somewhere you'd want to ask that that be included, and so we can get this into the document and make sure we address it. The second focus area is programs, funding, and services. There's going to be, just as communications became a theme as we went through these, there are going to be things that fall within these categories and the lines may blur, but these were really focused. This gets back to how we discussed it in your internal retreat. Again, many of those items came up repeatedly, which I think shows and stresses the importance of those particular items. If it came up under each subject area, then you know it's something that needs to be included in your action plan. The third was the planning, growth, and economic development. And then the fourth, the new one we created, was the communication and education focus area. So taking the final category, the who, how, and what, within each focus area, we created some bullet points under those focus areas that begin to be those action plans and those action items to begin to address those. Things that the commissioners have a direct effect on and that senior staff has a direct effect upon that begin to address those items that you raised of the most importance. And I would say if there is an area to concentrate on, if it is this area where you're looking at the actions that will take place. Make sure we've included what you think is most important, and we've covered those subject areas. But this is the area where I'm really looking for some feedback that you feel we're addressing, and we're finding those points that under each of those focus areas where there are actions you feel are important that you undertake and that staff undertake to address the issues. Again, that's under each focus area. So the other part that we went through in our internal retreat was our vision, mission, and goals. As we discussed the vision and mission, there was a consensus, I believe, that we not make changes to those. Those were still accurate and important, that identified what you feel is the vision and mission of the county. So I'm not recommending any changes to those. The goals, on the other hand, we did discuss making some minor changes to those, in particular taking actually goals 4 and 5 and making a single goal there. Particularly with Ms. Smith's help, we began to refine the language of those. So what you see here are some just suggested revised goals. Again, we're looking for your input on whether you feel those accurately represent the goals and those changes are something you would approve of. And so I would welcome any language or any input you would have on that. Again, want to repeat that any changes from this point forward, this is an initial draft, but any changes, you will see that in revised text. So each one of you see it, so you understand that if Commissioner Morris provides some feedback to me and I make that change, you will see those changes have been made, and you'll know where they've been made and can discuss them. There are already some changes and additions I believe are necessary just from the continuing retreats and summits that you've been holding. Again, there was some, I thought in particular in the business summit where you met with the business leaders, there were some points made that were extremely important. One of the ones that really stood out to me that repeated something that you had discussed, I think at the department head meeting, at the municipality meeting, and then in your internal, is why do people move to this community? I mean, what do people, and why do people stay in this community? It gets to the core of quality of life and quality of community. And then that was repeated by the business men. I mean, they're saying that there's something that attracted people here that's important to preserve and enhance and make sure that what makes up this community stays in place. So, while that may not be a huge change, it will continue to be a point of emphasis of this action plan. What we'd like to ask is that you provide these comments back to this document within the next 2 weeks. It's actually on your agenda, but Mr. Downs and I were discussing that it may be more important for us to discuss when you have your budget sessions. That you provide that input and we make these changes and get the draft back out to you, and then we use that time when we're together to discuss your budget, which is this is directly related to go through some of those changes that have been recommended. And again, I'm going to keep repeating myself, but each department has also completed a program summary that is part of the budget. Those are important. I mean, you're going to see numbers, and we're going to concentrate on numbers, but the numbers were developed by them developing a work plan, putting that work plan on paper, looking at what their core services are, what their objectives were, and how they intend to achieve those objectives and measure to see that they've achieved them or not. And that's what produces the numbers. So it's important to look at those program summary part of their budget, because that's a much more extensive written description of what we do as a county government and our services. This is your action plan, and it's going to encompass a lot of those areas, but the specifics fall within those individual departments. So again, this first draft is before you to start to read and consider, and then we would welcome any comments you'd have on it.
Thank you, Jonathan. I have, over the years, been involved in a lot of retreats and planning retreats and strategic planning sessions and so forth and so on, but I must say that I think probably this is the best job I've ever seen of collecting all that information and putting it into to something workable that we can go with. I mean, this board has spent a significant amount of time participating in all those events that you mentioned with different segments of the community, and to get that all put together in one document that we can massage and work with, I think is tremendously helpful. And I applaud you and the rest of the staff for doing that. And looking very quickly over this, there are a couple things that we talked about that have already been in place. We talked about a weekly newspaper column, which there was one in this past Friday's Independent Tribune. There's a mention about a speakers bureau. I know that Commissioner Honeycutt has talked about establishing some coffees or some such name where maybe 2 commissioners could just have casual time around the county for folks to come in and talk about whatever might be on their mind. I spoke to a group 2 weeks ago and mentioned that we provide opportunity for public comment at each of our regular meetings, that anybody can have 3 minutes to talk about whatever they want, and someone there said, well, that has to pertain to an item that's on your agenda. And I said, no, that is not correct. You can come and talk about anything that you would like. So all of these things, I think, get us closer in that direction of getting that word out to the public. Questions or comments from others? Okay, well, we shall do our homework.
Thank you.
Come back with additional responses to that.
So with that said, I believe right now it shows up as new business on your agenda. I don't believe it needs to be. If you're fine with providing comments by that point and then it going to your work sessions. The other thing is going back all the way to, I think, our first item, proposal to construct a new driveway for that one is not on your agenda. I had said that it could be on your agenda under consent to table indefinitely, but I think if we have a consensus, we could probably just move forward to table that indefinitely.
Okay.
So it would not.
Yeah, it's not currently on their
Yeah.
agenda, so.
So that way, but I think we've heard that loud and clear from you that you want it to come back after that action's been taken place. So we'll make that change and bring it back to you when it's appropriate.
Very good. Thank you. Okay, next is the approval of our regular meeting agenda, which you all have in front of you. I would agree with Commissioner Poole on consent agenda, item number 5, EMS, EMT affiliation, that we just specify, authorize county manager to execute that agreement after consultation with the county attorney. Does anybody else have changes to the agenda?
Just a resolution on that HCCBG.
And you want to remove item G3, which is what he just said, to
Yes.
remove the action
Right.
plan.
Remove G3. Okay,
There's a
you found,
resolution that's attached. Wasn't there a resolution with that HCCBG plan? Because that's not shown as an action here.
yeah, you might,
I'm looking at the paper copy in front of us.
Approving the plan itself, not a resolution.
I mean, that's, I don't know if that's different.
did you figure it out? Okay. Okay, any other additions or changes or deletions?
I make a motion that we approve the agenda as presented with the deletion of item G3.
Okay, do I hear a second to that motion? Any discussion? All in favor say aye. All opposed, no. Motion passes.
Before we recess, can I mention a couple things?
Certainly.
I don't know how many of you went to Spring Into Arts Saturday that was on Union Street, but I wanted to mention Kasha and the other folks in her department because they were out there all day long handing out flashy lights, the Channel 22 lights, and they were going very quickly. I don't know how many you gave out, but several hundred. But I know you were there all day, and they were there in and out, and also Perry with Parks and Rec was kind enough to put up a tent so that they were in the shade because they were in a very sunny place. So we had mentioned, and you see it in the plan, where we want our communications department to do a lot of things. I mean, in all honesty, there were a lot of things we talked about with them. So I wanted to point out that they were there all day long, and I think they made a good representation. I even offered to stay the last hour and a half and let her go on home, and she wouldn't let me do it. So she was working hard. And to verify Government 101 is this Friday? You have to, I was going to call her out, because I know I have, a friend of mine mentioned today to me that she was all excited to be here Friday, so if you want to do a plug
We
on
have
that.
a Government 101 class class on Building Cabarrus, which features our Planning and Zoning Department. The class holds 20 participants and goes all day long from 9 in the morning till 2 in the afternoon, and includes interactive activities and presentations. And this class, I'm proud to say, is book solid. So we have no room for this one, but anyone interested in participating in our next Government 101 class can email outreach@cabarruscounty.us. Thank you.
Thank you. Okay. We would at this time entertain a motion to recess until 12 p.m. on Friday, May the 8th, when we will meet along with the Cabarrus County School Board for an educational session. So do I hear such a motion? Okay. Have a motion and a second. All in favor, please say aye. All opposed, no. We stand recessed. Thank you.